Economics, public health, and politics are at the front and center in the days to come. And as an epidemiologist and Detroit's former public health director, our next guest knows about the impact of all of those quite well.
Indeed. Currently he hosts Crooked Media's America Dissected, and he's written a book called Healing Politics, A Doctor's Journey into the Heart of Our Political Epidemic. Dr. Abdul El-Sayed joins us now via Skype. Welcome back to the show, sir. Great to see you.
Thank you so much for having me.
Good to see you, Doctor.
So we wanted to talk to you about, it seems like the president and a number of other figures on the right are sort of making a pivot from, okay, we did the lockdown. It was incredibly destructive to the economy, so we need to figure out how to get people back to work. Just talk as a doctor about your reaction to those comments and that approach.
We are not at the beginning of the end. We're at the end of the beginning. What we're going to start seeing is a spiking in cases that doesn't bode well for the preparedness of our healthcare system. I think, unfortunately, we're hearing from doctors every day, people I went to medical school with, who are worrying about whether or not they're even going to be able to test their patients because there is still a lack of testing kits. They're worried about going into the middle of the hot zone without the personal protective equipment that every doctor needs to be able to care for patients. And they're worrying about the increasing number of cases. Right now in the United States, our doubling time, the amount of time it takes to go from one set of cases to twice as many, is 2.5 days. When we talk about flattening the curve, the thing that we want to do is increase that doubling time. So there's more and more time between every time the number of cases doubles. But we're at a higher trajectory in our epidemic right now than they were at the height of Italy's. And we're seeing the consequences hit our hospitals just like they hit Italy's. And so we've got a lot more work to do. We can't be declaring victory and going home. This is something we're going to have to tuck into for a while.
Doctor, one thing that has mystified Americans is how is it possible that we don't have the personal protective equipment and the ability in order to deal with a crisis like this? And it seems endemic to something that you have spoken about for a long time, which is the structure of the American healthcare system itself. Can you talk a little bit about that?
Yeah, well, look, there are a couple of reasons why. Number one, if you're going to take on a pandemic, it's like fighting a fire. If you can fight it while it's small, then maybe you only really need your own pot of water. But if it engulfs your house, you're going to need the fire truck. But if it engulfs the whole neighborhood, it doesn't matter how many fire trucks you bring, you may not be able to take it down. And unfortunately, we failed to nip this in the bud when it was small. We had cut our public health infrastructure to be able to do that. And now we're dealing with it when it's big. And so it's overwhelming our healthcare system and the capacity to be able to provide the set of personal protective gear and basic equipment that we need to beat this. But there's another part, too, is that it also uniquely disrupted supply lines from which we got a lot of these plastic-based and rubber-based protective equipments that we use. But you're right. It does point to a bigger structural failure in our healthcare system. Our healthcare system right now is a matter of figuring out how to make money off of different kinds of patients, gearing the entire system around doing that, whether it's the payers, the insurance companies, or it's the providers, the hospitals, or it's the pharma companies who make drugs, or it's even the medical tech companies who make the devices that we use in healthcare. All of them are focused on a bottom line. Obviously, that kind of system is not geared to handle the kind of mass influx of patients that are going to come with COVID-19. And so we have the wrong healthcare system for this. I do hope if and when this is over, and yes, it will be over, that we think a little bit about what we want to build in its stead, because this clearly isn't working.
Yeah, I think that's well said. And on the political front, we've seen support for Medicare for All rising during this crisis, understandably, because people see the flaws in that system. They see that it's not just about them having coverage, it's about everyone having coverage so that we can stay safe together. And at the same time, as we do face down this crisis, a lot of hospitals are saying that they're going to have trouble meeting payroll in the coming days if they don't get some help here, because they rely for their bottom line on a lot of elective surgeries as they've geared up to focus almost exclusively on, certainly essential services and the crisis response. They're running out of cash. What do you think that we should do there?
Well, look, there's no doubt that we have to keep our hospitals open, but let this be the moment that we realize that this system is just unsustainable. It is not working. A system that is predicated on hospitals doing elective surgeries, right? Elective things that people don't necessarily need right now, that may be important but aren't important right now, isn't the kind that is geared up to take on this kind of system. We can have our cake and eat it too. If we were to engage with Medicare for All the way that we ought to be, the way that almost every other high-income country in the world has, we would be in a very different position in terms of our ability to meet this need because the government would be the funder. And so the government could just put that influx in. Now you've got hospitals who are run as businesses, just like every other corporation, are out looking for a bailout. Look, right now we got to keep them open. They are our lifeline. We have to make sure that every hospital is as staffed and as ready as possible for this. But it's a sad state of affairs when what they like to call the greatest healthcare system in the world, and certainly by some of the numbers it's true, can't meet the need, the basic need of being able to care for patients on the front lines in the context of a pandemic.
So, Doctor, another thing I want to focus on is this testing, because as I understand it, the only way we can open things up again is with widespread testing, as we've seen in some of the Asian countries. Why is it taking so long in order to ramp up testing? Is it a manufacturing problem? Is it a money problem? Is it FDA? All of the above? Can you explain that to us?
So it's two problems, I'll say. Number one, we stumbled out of the gate, and so we were behind from the first place. And once you start behind, you're gonna stay behind. But the second problem of it is that there's a lot of money in our healthcare system. It's just in the wrong pockets. And so when supply lines got disrupted, we didn't have an easy way to be able to articulate a future forward where we could manufacture these kinds of tests at scale again. And all of this points to one of the central theses in the book that I wrote, which eerily is coming out at a time when it seems unfortunately too relevant, is that our whole system, the system that undergirds our way of living, has been so bought off by money interests, by the ability of a corporation to make a dollar, that we never built in the kinds of security, the kind of safety from exploitation and vulnerability that we're seeing across the board, whether it's people working gigs, or it's people not being able to get healthcare in the context of a pandemic, or it's our supply lines not being able to catch up with a global need for something as basic as protective gear and testing kits at the front lines in the context of a pandemic.
Yeah, and part of why you're such a great voice on this, Doctor, is because what we're seeing is a sort of horrific intersection of politics and medicine and pandemic, and you're an expert in both areas. I understand why workers would find the calls to let's just get back to work compelling, especially as Washington fails to be able to pass a bailout package that would be sufficient and up to the moment in order to give working people some sense of comfort that they're not going to get kicked out of their homes, that they're not going to have their entire life and livelihood destroyed by an inability to work. What do you think Washington needs to do to make sure that we can deal with the public health crisis, but also ensure that workers are going to be okay?
Yeah, that's right. One of the hard parts right now is that, when you think about this moment, if you listen to the president of the United States, who, in the past has been a credible speaker on what the country ought to be doing, after all, he got elected, you'd think, okay, cool. So he's saying that it's okay. The problem is that our economy is predicated, every economy is predicated on the ability of people to exchange with each other, whether that's goods and services or even ideas. And insofar as people are unwilling to make contact with each other because they're afraid that there's a pandemic raging, which is not something that the president can change with his words. You can't spin biology. It's going to hamper the economy. And the worst thing that we could do for the economy, given that so much of it is about projections about the future of the economy, is to tell folks that it's okay and it's going to be on its way back, and then it stumbles again and fails. That is the way you turn a recession from a pandemic into a depression. And unfortunately, that's what it looks like the president is on his way to doing. And so we've got to be serious about the biology here and lead with science first. It's what public health folks and even political folks have been talking about from the beginning of the crisis. Don't go up there and blather on the microphone every day. Instead, put your public health people, put your scientists up front, let them reason with the American people and just explain where we are and why we're here. You do the things that you need to do to get the resources that we still don't have onto the front lines. And unfortunately, the president thinks that with his words, he's going to spin the biology and that somehow it's all going to be okay because he said it is. It doesn't work that way, and I fear what the long-term consequences are if and when we start stipulating that it does.
Mm-hmm. And so, Doctor, how much longer are we in for this? I mean, that's the really question that's set on everybody's mind, which is realistically, what we've learned on the countries that come before us, how long does it take to flatten the curve with the measures that we have in place right now?
Yeah, so each of them has taken upwards of about 2 months. But here's the thing. They were flattening the curve. Our doubling time, which I told you about, right? You're looking for a longer and longer doubling time because you want a longer time within which the number of cases doubles. It's really low. It's 2.5 days, and it's not like it's increasing. It's actually getting shorter. And so we've got a lot more work to do to flatten the curve. We actually, on my podcast, America Dissected, we interviewed a professor at Yale who is an infectious disease modeler. And we talked about how people make these assessments. And you've got, estimates that are lasting 2 months and estimates that are lasting 18 months. My hope is that the American people come together. Our leadership recognizes that you can't spin biology, that the only way to revive the economy is to clear the pandemic and to reduce the number of cases, that we are willing to invest in social distancing for the time being so that we can have our future. And we realize that all of us are in this together. Public health truly is public. If any of us cheat on it, it hurts all of us, right? This is a moment for all of us to realize that, like, we're in this boat together. My health is my neighbor's health, is the health of that individual living across town in a community I don't go to often. Like, that's the thing people need to be realizing. This artificial segregation that we have isn't real. And when we're hit with pandemics like this, we've got to realize that actually our well-being is only as good as the poorest and most marginalized and sickest of us. And it's time to invest in them too.
Yeah, I like the way you put that, invest in social distancing, because it captures the idea that, look, if you aren't providing people with the support they need right now to be able to weather this storm financially as well, they're not going to continue to respect the public health guidelines, because ultimately they're going to have to get out there and feed their families. So I like that. I like that phrasing. It's so great to have your insights today, Doctor.
Certainly.
Thank you so much for being with us.
Thank you, Doctor.
Yeah, I really appreciate you having me. Thank you, and stay safe. And for all the folks who are watching right now, go inside, stay at home. It's not worth it, and we've got to keep ourselves and our seniors safe.
Certainly.
Thank you for that.
Next on Rising, friend of the show, Ryan Grimm, weighs in on Warren, Bernie, Biden, and everything else on coronavirus. That's next.